So hi, my name is Tzountzouris, and I currently work for the College of Medical Laboratory Technologists of Ontario in member relations and policy. My experience has been that it's been local solutions to local problems. So although there's a policy drive to embed interprofessional collaboration, really there's a lot of enablers and there's a lot of barriers. And again, there's a lot of literature written on this. And what happens at the local level will depend on how those enablers and barriers play out. But let me use a specific example in the medical laboratory technology world to demonstrate. So in a previous employment, there were some issues that were occurring in the core laboratory with turnaround times, and specifically with turnaround times from samples coming from the emergency department. And you can imagine that's a high-risk, high-stress environment where they expect a certain level of service. And what the nurses were finding was they were drawing specimens from patients, sending them to the core lab, and they were whether mislabeled, unlabeled, or the wrong specimen. And the lab would receive them, and they have their processes to follow and procedures to follow. And they're grounded in patient care. You cannot accept a specimen that is unlabeled. Even if somebody calls you after the fact and says, "Trust me, it's Mr. Smith," it doesn't work that way. What if it's not Mr. Smith? And so the nurses were calling the lab and talking to the MLTs, and were getting quite upset about the lack of responsiveness of the turnaround times. And the MLTs in turn would say, well, okay, but you sent X, Y, and Z specimen, it was mislabeled. And the nurses felt that this was an attack on them, and communication fell apart, essentially. So what happened was the managers of both departments took a leaderful role, I believe, in rising above the issues, which were very important, and looking at it from a process perspective, and got together with a couple of the nurses from the emergency department and the medical laboratory technologists and spoke process. Instead of, this is what happened, I did this, why didn't you do this? Let's look at the patient experience. So this goes back to interprofessional collaboration. Let's look at the patient experience. Now in this case, the patient experience isn't that they actually have to go and get their blood drawn and go to the lab and wait for their result. But the patient experience is they have their blood drawn and they're waiting for a result in the emergency to determine their next course of action. So it is pretty high anxiety in some cases. And they wanted to reduce those turnaround times. The med lab technologists got to learn about the nurses, and the nurses, for their part, got to learn about process in the laboratory and some of the things that could improve the turnaround times. So they started to chart some of the data around some of the more important tests or the more high volume tests that the nurses were ordering. And this is important because one of the other things that supports interprofessional collaboration is proof, data. Show us that working together actually makes a difference. And this is an example of where working together did make a difference. Because what happened was they saw an observable reduction in turnaround times and an observable reduction in specimen errors, which affected turnaround times. So these folks working together, being able to break down their boundaries, being able to speak a common language and focus on process, I believe is what enabled change. When I worked in an acute care hospital, I was managing 2 laboratories at the time, and one of which did laboratory analysis on prenatal specimens. So there was a very important turnaround time that we had to meet that was supported by international and national standards. And possibly due to workload issues, possibly due to staffing issues, our turnaround time started to slip. So we did have systems in place to actually track turnaround times. And we did track them on a monthly basis, and we noticed month to month that they were starting to slip. Unfortunately, these types of indicators don't help us because we find out after the fact that they've slipped, and these patients now have had to make some very difficult decisions because we haven't been able to get the results to them on time. So my role was to reduce those turnaround times. So I went into my staff and said, we need to get these turnaround times down. And there were a lot of negative reactions. There were a lot of reasons why that couldn't happen. But I had to persuade my staff to take action to find a way to reduce these turnaround times without using extra financial resources, meaning you couldn't stay and do 6 hours of overtime every day. That's impossible, they said. We're working too hard, they said. So I worked with them to focus on process improvement. I worked with them to enable them to find the solutions to the problems. And at the same time, I implemented real-time charting of turnaround times. So every single day, cases were going in and out, and we were tracking the turnaround times and the workload for each and every medical laboratory technologist. And that was also posted for everybody to see. The turnaround times decreased dramatically, and for the first time in 4 years, we hit our target. And we continued to hit that target for many, many more months after that. It was very, very labor intensive on my part, and very labor intensive on a system, from a systems perspective, to constantly be on top of our folks. But at the end of the day, part of the reason it worked was because the individuals themselves not only saw that we could track the data and chart the data, but they also understood the importance of the data. I don't think without the graphical representations, they really understood how many patients were not getting their results within a certain time frame. And it can be said in the context of medical laboratory technologists, and I hear this all the time, that folks don't know if we're patient-centered or not because we don't see patients. We see samples, we see blood samples, we see whatever type of sample you see. My experience is that medical laboratory technologists actually are very, very patient-centered. However, sometimes our impact, collective impact, is lost on us because we deal with individual samples. We lose touch with the fact that every single day hundreds of thousands of specimens are being processed and hundreds of thousands of results are being put out, and the impact on the healthcare system is quite immense, actually. So once these MLTs started to see the impact that they were having, or the lack of impact due to the delayed turnaround times, I think it put the issue right in their face, and it helped persuade them to be part of the solution.